All right. I was forgetting unless we get the announcement. So thank you. Thank you for stopping us. So today I'm really honored to be here to talk about the transformative power that we know emerges when we invest in relationships, share resources equitably, and uplift the lived wisdom and the leadership that already exists within our communities. And so at Fairview, we really hold strong in the belief that partnership means working with community, not just for it. And so today I'm going to share an example of a powerful community collaborative that I'm fortunate to be able to dedicate a really significant amount of my time to. And through that, I've had the chance to work with Sarah and the Network for Public Health Law. And so Sarah is going to help me in sharing some pieces of tonight's presentation to share what the experience has been like and how being part of this collaborative brings value to her work. And so with that, we will jump in. And again, just an open invitation to please post things in the chat if you have comments or reflections, or you want to share any resources for the good of the group. Feel free to engage with the chat throughout the session today. All right, so jumping right in about our collaborative. So a little bit about the Eastside Health and Wellbeing Collaborative. We are a network of committed community organizations, social service providers, and systems partners that are all working in relationship to advance health equity and foster collective well-being on St. Paul's East Side. So together we are working to really strive to build a future where all residents, no matter of their background, can thrive in a vibrant, healthy community. And so we take that neighborhood level approach to addressing health equity. We believe in shared power, shared purpose, and shared responsibility. And our work is sustained by trust. And we really can only move at the speed of trust, mutual accountability, and deep commitment to improving health outcomes in ways that are rooted in community voice and guided by community priorities. So coming up later this year, the Eastside Health and Wellbeing Collaborative celebrates nearly 10 years of partnership. So we're celebrating a decade of showing up, working together, and building something that we really believe will last. We're proud to have a core strong group of around 24 longstanding community partners, many who have been walking alongside each other since the beginning. And you can see these partners reflected on the screen. And while our foundation has been solid, we've had this consistent group of partners at the table. We've always made space for new voices and organizations that strengthen and expand the impact of our collective efforts. We know different organizations move in and out of the community, they stand up different services, and so we always want to remain flexible and be able to uplift those things. So the collaborative is convened by Fairview, and although it is convened by us, our system, our priorities, our strategies, and our actions are shaped with our members. And so this work is truly co-created, and the power is shared across the table. I've had the honor of working with a number of collaboratives over the last couple of decades, and I've rarely seen another model that holds such consistent and committed participation over long periods of time. So we may have different staff that cycle in and out of organizations, but our membership core has remained really solid. And it's not an easy thing to sustain work like this. One of the ways that we've been able to sustain this deep engagement is through intentional investment. And so member organizations are eligible to apply for an annual partnership grant to support their involvement. And we currently have 2 active work groups that you'll hear a little bit more about in just a bit. And partners can receive funding for participating in one or both. And we do that so that we can recognize the time, labor, and the wisdom that they bring to the table. And so that's something that really, for some organizations, in particular, some of our smaller organizations, that funding can allow a staff person to be able to dedicate some of their time to this shared work. And so we found it really important to keep that partner support in place. And so I'll share that at Fairview, our role has largely been that of the convener, the funder, and a stabilizing force. And so we really are, in addition, while we provide the financial resources for the collaborative, really want to be an equal member at the table. And so we know that the real power and the sustainability of this work comes from the relationships and the leadership within the collaborative. And for us, it's really not about ownership, it's about stewardship and standing in partnership with the community. And it really aligns with our efforts to be an anchor in this neighborhood. So I'm going to get into a little bit more about the nitty-gritty of the collaborative and share a little bit about our operating structure and how we go deep in advancing our collective work. All right, so we are rooted in 7 guiding principles, and these were formed by partners who were at the table during the time that our collaborative was formed. And we have continued to strive to live up to these principles as we deepen our work and look for other areas for investment and action. And so we want to maintain that neighborhood-based approach. And so within our network and more broadly, we work to create increased awareness of other organizations and resources on St. Paul's East Side. We want to be kind of that welcoming entity as new folks join the community. We want to know what services and programs are there and who is doing what so that we can leverage existing resources, make appropriate referrals, and make those connections. And being able to do so has really led to an increase in collaboration among partners. So there's the collaboration that happens within the collaborative and the few different initiatives that we'll share about tonight. But then also partners support each other in some pretty phenomenal ways. We recently had one of our youth programs that they were meeting in a church and the basement flooded. And so we had 3 or 4 partners who offered up space. And it can be tough to find space for like 70 squirrely kiddos last minute, just as you're running youth programming. So it's just great to have that strong network, and we really rely on one another, particularly during tough times. Also within that neighborhood approach, we want to really be intentional about serving everyone who lives, works, learns, accesses services, chooses to pray or play on the east side. And we do so with that acknowledgement that we know that zip code predicts health more than genetic code. And so we have to take those neighborhood level strategies, those really targeted approaches. We also want to actualize equity in health and well-being. And so we use a health framework that considers physical, emotional, spiritual, and relational aspects, including tailored approaches in program delivery that honor cultural definitions of health and well-being, and that pays attention to diverse preferences and communication and process. And so as we think about how we're showing up and supporting our community, we remember that healing is not always about curing. And so we engage in prevention, treatment, and maintenance approaches as it relates to healthcare and health and well-being. We also want to just recognize the influence of power and systems and health outcomes and understand our system's role in that and work to change those systems to increase health equity. And so we maintain that equity and inclusion are always explicitly present in our language and design. And we focus on fostering trust, making people feel safe, and making sure that the whole person is respected and welcomed. Acknowledging that as human beings, we are complex and we carry multiple identities with us as we show up in different spaces. And to that end, we design for the complexity of people and communities, and really want to engage with all St. Paul community, all communities and cultures represented on the east side of St. Paul. We want to honor and really value the complexity of how communities choose to define themselves. And a lot of our programs are designed to benefit those who are part of the non-dominant culture, non-dominant audiences. We design programs that bring a wealth of diversity in age, gender, sexual orientation, stage of life. We want things to be, look at the whole lifespan, socioeconomic status, ability, and family compositions. We put relationships first. And I would say that's one of the things that is one of my favorite parts about working for Fairview. We really go deep as it relates to honoring relationships, honoring community wisdom, and putting relationships first. And so we really prioritize building those relationships and maintaining those connections between our system and the larger collaborative, all of those organizations, but also to help broker trust and connections in between our different partner organizations. We know that in doing so, we're able to increase the ease of referrals between organizations and programs. And then we're also able to, cross-promote or co-promote our different partner organization offerings. And we're going to talk a little bit more about this co-creation process, but we co-create. And one of the things I'll note about this is that we really lean into a very intentional process, and we value that process, I would say, as much as the outcome. When we're wanting to build something that is really community grown and sustainable, we really had to take our time. And we wanted to make sure that it was a safe space so that everyone's voice is heard. And we acknowledge that we don't need to do things the same old way. And so this is a space where we can innovate, try new things, test new things in the community. And through that, we are leading into continuous learning. And we know that community conditions change, and so we must remain agile. We work to respect autonomy, and so we want to understand and value the self-determination and choice of each individual and organization within the collaborative, those served by the collaborative, but also just understand that organizations have, their own areas that they stand for and that they support and that they represent. And so we want to make sure that we're respecting our individual organizations' identities as well. And we continue to just engage, although organizations are doing different types of work, we all rally around these shared principles and really have a focus on designing for sustainability. And so we prioritize sustainability in our processes and our outcomes, and we put resources into really defining and evolving that process over time. Another piece about that designing for sustainability is we do try to focus on our impact on the environment. And so when we're hosting community events or have different initiatives, we really try to focus on having zero waste or low waste events. And so to close this part, I'll say that, keeping centered and grounded in these principles really continues to be a strong foundation for our work, something that has been around since its inception and has continued to be along with us in this journey. So now I'll share a little bit about how we are structured and how we function as a collaborative. So you can see our different kind of operational components. And our collaborative is intentionally designed to allow for multiple points of connection and participation. We know that each of our partner organizations bring very unique missions, priorities, and different capacities. And so we've created a structure that's both flexible and inclusive, allowing members to engage in ways that are meaningful to their work and aligned with their passions. So at the core of our engagement is our full collaborative, which comes together in person 4 times a year. These gatherings, I think we have another one next month. I think we have one next month, Sarah. These gatherings around us give us space to reconnect, share updates, align on priorities, and build relationships across sectors. And in addition to our in-person meetings, we've also increased our virtual touch points, especially during these times of uncertainty with a number of executive orders impacting the work that our partners are doing and that we're doing. And of course, with shifting political currents. And so these virtual check-ins have been a great way to remain anchored in solidarity and offer a steady presence when our partners are navigating complex and ever-changing realities. Sometimes we gather and we don't even have a formal agenda. It's like we're just checking in with one another. What are you hearing? What can we help respond to? What resources do you need? And so we make sure that we create those touch points for engagement in between our in-person meetings. And then we have 2 work groups. And so we also organize our work around 2 focused work groups. At one point we had 3, and we're going to touch on that third one because that work stream is still involved. But our mental health and stress resilience partnership work group and East Side Table. So the mental health and stress resilience partnership brings together organizations and individuals that are passionate about mental well-being and healing-centered approaches. And then our East Side Table work group centers food access, health, and community-led solutions. And both work groups gather during our quarterly collaborative meetings and then continue their work through project teams that meet in between. These groups are really where the vision becomes action and where we move our ideas from just ideas into implementation. And then our last area of engagement is our policy work stream. And so like many things, this area evolved during and throughout COVID. Most recently we had paused to reflect, recalibrate, and now we're rebuilding it in a way that more effectively channels our collective power to influence policy and advocate for the needs of our communities. And so earlier this month, or maybe it was March, since COVID, my brain just does not grasp time the way that it used to. But earlier this year, maybe a month ago, maybe 2 months ago, we held our first ever Day on the Hill. And that was where we were able to bring our voices directly to East Side legislators. And so it was really powerful for us to be able to share our priorities and kind of flex that collective muscle of being able to talk about ourselves as a coalition and a collaborative. But it was equally important to hear from lawmakers and understand where our work group aligns with their work so that we can partner for greater impact. And so out of these, the 2 work groups, the mental health and stress resilience and East Side Table, we have some pretty powerful programs that have emerged from that. And so I'm going to share a little bit about 2 programs that were birthed out of those work groups. So tonight I'm going to have a chance to touch on cultural brokers and East Side Table. And although we don't have a ton of time tonight, I could brag about these forever. So if you want more information after tonight's presentation, I think my information will be shared, and please feel free to reach out. So our Culture Brokers program is the first one I'm going to talk about. And the Culture Brokers program was co-developed in 2016, early 2016, by Fairview's community advancement team that I'm part of, and our East Side Health and Wellbeing Collaborative, specifically the Mental Health and Stress Resilience Partnership Work Group. Culture brokers help bridge cultural gaps by translating and supporting people as they navigate healthcare, schools, and other mainstream systems with the focus of building self-sufficiency. And so culture brokers do a number of things for individuals and families. They help them with accessing critical information and essential resources that they need to reach their full health potential. And the cultural brokers that we work with belong to the communities they serve, which means they can more easily build trust and can have a greater impact on communities' health. So our culture brokers provide people with, information and resources. And we want to make sure that we provide it in a variety of ways, in different formats. And we focus on things that are not uniformly accessible across race, age, language, socioeconomic class, sexual orientation, immigration status, gender, or ability. And so we really want to have leveled that playing field and make sure that we're putting those services and resources within reach. These services are provided free of charge, thanks to a grant from the Fairview Foundation. And so I'll say the cultural brokers program, and then the other program that we're going to share about in a bit. Those are all funded through the Fairview Foundation. So we have a base of funding that supports the partnership grants, as well as the different programs that have come out of the collaborative. Provide some of my staff time, and then also provide some additional resource to partners as needed. So people visit culture brokers for a number of reasons. When we're looking back at 2024 data, looking at the top reasons for people to visit a culture broker, people are looking for assistance with housing, with employment, accessing food resources, navigating healthcare. Even for people that work in healthcare, it can be really complex to figure stuff out. Legal paperwork, medical insurance, helping people apply for medical insurance. And while we don't provide direct legal services around visa, green card, citizenship issues, we do provide those linkages and referrals. One of the things I'll note about our culture brokers is that as COVID taught all of us a lot of things, we really pivoted and adjusted how our culture brokers operated during that time. And so, prior to COVID, a lot of the focus was on navigating complex healthcare systems, which was a full-time job in and of itself. But we saw needs just change and become much more vast as a result of COVID. And so, I think of an example where a culture broker would support a family who, someone who maybe was being discharged from St. John's Hospital after a COVID diagnosis. And they were told that, they needed to isolate, they needed to distance, and didn't have the means to do so. And so sometimes we'd have a culture broker that would step in and support that person, help with grocery delivery, getting their prescriptions sent to their house. In some cases, folks are being asked to socially distance or isolate, and they live in multi-generational homes where that just wasn't possible. And so cultural brokers work to find some temporary housing solutions via hotels or other short-term things, just to help people really lean into health recommendations and support them during that time. And we saw a lot of the work being helping people access critical services during that time. And so COVID, I think, forever shaped us and shaped our communities, and really informed how we work with people on a very individualized basis. So a little bit more about just how the culture brokers work. And so these are team members that are employed by Fairview, but they are fully embedded within partner organizations, meaning that they don't just work alongside our partners, they really become part of the fabric of the host site's team, culture, and the daily rhythms. And so we use a co-supervision model where each cultural broker is supported by two supervisors, one from Fairview and one from their host organization. And this approach really helps ensure that their work is grounded in community while also being connected to healthcare resources, allowing for aligned priorities, consistent guidance, sharing of resources in that referral piece, and also mutual accountability. And the impact has been really powerful. The deeper partnership strengthens trust between Fairview and our community partners. And it also helps with making smoother pathways for community members to access clinical services, and not just through like a handoff or a phone number, but through like handing off to a trusted relationship. And so these connections ensure that when care is needed, it's timely, culturally responsive, and rooted in trust. So on your screen, you can see we have we represent 5 different cultural communities, and currently have 6 cultural brokers. And so 5 of them are focused on the East Metro. Started out really kind of east side of St. Paul, now has grown to more broader East Metro. But I will say cultural brokers field requests from statewide, from all across the state. And so we have we have 2 Latin cultural brokers. One is in Minneapolis, but these other 5 are located in the East Metro. And so our African American cultural broker is housed at Family Values for Life. Our Native American cultural broker is at the American Indian Family Center. We have a Latin cultural broker deployed at Clues. Hmong American Partnership hosts our Hmong cultural broker, and then the Corinne Organization of Minnesota is the host site for our Corinne broker. Let's see. Just sharing a couple of things about some program outcomes at a glance. So just thinking about like who are we serving? Demographics of the program. The average age is 38. Last year, based on that data, 60% stated that their primary language was something other than English, and 70% of program participants identified as female. And then as we look at our program impacts, and again, this is data shared among the, at this time it would have been 5 cultural brokers. We added a newer one this year, but at this time, 5 cultural brokers, they saw 510 new participants during last year. And these are not usually just like a one and done kind of thing. These are folks that are like deeply connected to folks, providing case management and support. And people may, kind of cycle in and out of their needs for working with a culture broker, but that door is always open. 94% said that they felt that working with a cultural broker helped decrease stress. We know that right now, a lot of us are carrying a lot of stress with us. And so what we can do to support health and well-being by decreasing stress is really valued. They 83% said that they now have somebody that they can rely on for support. And almost 80% said that they feel connected to others in the community as a result of working with the cultural brokers. And so I will just say, to close out that piece, these are superhuman folks. We wish we had so many more of them. But what this has done is has allowed us to really look at a community-based response that has had true impact. And now we're looking at how we can replicate this in other parts of our geographies, knowing that it's not a one size fits all, and really wanting to tailor those solutions like we have in this case, to meeting the unique needs of different communities. All right, East Side Table. Now we got all warmed up talking about our food and our favorite bakery. So now we will shift to food. So to share a little bit about our East Side Table program, which grew out of the collaborative and now has become part of Fairview's larger system response, as part of our Food is Medicine, Social Determinants of Health pillar. And I'll share a little bit later just briefly about Fairview's different SDoH initiatives. So East Side Table grew from a shared desire to nourish the east side of St. Paul and its residents. We do every 3-year triennial community needs assessment. And so that is a piece that also lives within in my team. And when data showed clear gaps in access to healthy food and food skills, at the time Health East, now Fairview, brought together community partners to find solutions. And so with strong support from the St. Paul community, a working council of 13 local organizations who continue to be collaborative partners came together with a common goal to nourish our neighborhoods. After 9 months of collaboration and planning, the group identified key barriers to health and nutrition and created an inclusive community-centered plan called East Side Table. At its core, East Side Table celebrates the cultural richness in our community, and our program reflects and uplifts the diverse voices of Dayton's Bluff, Payne Phalen, and the greater East Side, with resources and services available in multiple languages. East Side Table is working to address food insecurity and nutrition in our communities through our meal kit programs, community events, and food skill resources. And we aim to reach as many of our neighbors as possible. And so together, we really want to uplift and celebrate culture, build relationships, and focus on how we can not just nourish our bodies, but also our souls. So a couple of things about just how East Side Table works. And so again, this is grown out of one of our community health needs assessment identified needs. This is something that has been validated cycle after cycle. We see a lot of food insecurity. And so one of the things that I think has been just a beautiful piece of this is that we have a number of clinics on the east side of St. Paul, and we would have physicians who would tell us, they would have a patient present and they would have some kind of a chronic condition or an illness that could be supported by a better, healthier diet. And so, physicians were faced with the reality that they knew what could help someone, but didn't have the resources available to connect them to those resources. And so with our East Side Table program, now providers can say anybody that comes into our hospitals and clinics are screened for food insecurity along with some other SDoH domains. But now doctors can write a prescription and have people receive a meal kit or a food box, and they can be part of our food kit or our meal kit program. Which will provide 2 to 3 days of food each week. And then we have other options that providers and other hospital and clinic staff can also use, because sometimes we'll have folks that present at the clinic that day and their screen is being food insecure, and we want to have that immediate response. And so we also have shelf-stable bags at all of our clinics and hospitals so that we can send somebody home with a bag of groceries and different items when they leave that site. We want to continue to really invest in these relationships that we have as part of East Side Table. We want it to go beyond just cooking a meal and sharing food. Really want to use food as a way to build community. You can see one of our food boxes in the image on your screen, and we focus on having beautiful, locally sourced food. I've worked with a number of programs over the years where we were doing like food rescue, or we're doing produce distribution. And you tend to get kind of like the ugly food, like the food that it feels like you're getting, like secondhand stuff. And we really want to make sure that we are preserving and having dignity in these meal kits and the foods that people get. And so beautiful materials, locally sourced foods that come from 41 different BIPOC farmers that we work with in the area. And one thing that if any of you have ever done like HelloFresh meal kits, or if you've done one of the other food box delivery programs, they'll give you, if you have a recipe that calls for some kind of a sauce or seasoning, they give you a packet of just a packet of that. And in our case, if it calls for sauce, the box will, or calls for soy sauce as an example, the box will contain a bottle of soy sauce so that that can become part of their pantry and they can use it to make other creations. We also know that cooking is not everybody's natural skill. And so we host community cooking events where we share a community meal. People can learn a new recipe, a simple one. And then we leave folks with the materials and ingredients to make those recipes at home. And I did bring a couple of examples of different recipes that we have had in our different meal kits. And I think we're going to share those. And they're all fairly simple. Sometimes, I will say many times, there are foods that I have not even heard of before. We had and this also supports, kind of building relationships and community. We had a woman who had received a meal kit and had no idea what one of the vegetables was, and had heard from someone else that this was a common vegetable used in the Hmong community, and her neighbor was Hmong, and so she walked over and said, "Hey, nice to meet your neighbor. Can you help me figure out how to use this?" And so from that, kind of branched out this, sharing of resources and sharing of recipes and building a relationship through what initially started out as a connection around food. All right, so just a couple of pictures. I had mentioned that part of my work involves working at the Fairview Community Health and Wellness Hub, which we have repurposed to really bring new life to it. And on the left-hand side of your screen, it's a little bit blurry, but that is our former ambulance bay and emergency department entry there. And we have converted that to be our food processing and packaging space, where the East Side Table meal kits originate out of, as well as our other food support programs. So every single week we process more than 100,000 pounds of fresh produce through that building. And it also serves as a really great training ground for young people. And so we have about 20 to 25 young people from local nonprofits that staff this food hub. And so they're learning, employability skills. They're navigating employment systems. They're learning how to solve conflict on the job, and just having and also learning about food throughout the process. And so they're making between $15 and $18 an hour and working usually about 15 to 20 hours a week, and that changes with different seasons and, of course, aligning with the school schedule. And then I mentioned before our support of BIPOC farmers, and that's probably one of the biggest points of pride in this work. It's been a tough time for farmers. It's going to continue to be a tough time for farmers, and so we invest heavily in our local BIPOC farmer ecosystem. And we have conversations with them well ahead of their growing season so that they can be aware of what type of financial resources and other supports they'll have at their disposal as they plan for their crops. And that has really helped to add some stability in this ecosystem. We also take an annual farm tour where we take participants that are part of our different meal kit programs out to visit the different farms and see where their food is coming from. We really want to make sure that we're continuing to invest in these farmers. And so we have them connected with other areas of Fairview, and so for some of our different hospital sites that are in the local communities that they support or that they operate out of, we source local food from them, and so it goes really beyond our different meal kit and meal programs. All right, so East Side Table. So just talking specifically about the East Side component of this. And again, it's this work and this structure has really grown to be a much bigger food response within Fairview. But as we're thinking about just East Side Table, last year we distributed more than 3,900 meal boxes. We're serving about 300 households a week. And then also the program facilitated more than 1,700 grocery deliveries to East Side seniors. And so we partner with some of our Eastside partners who specialize in caring for our aging community members. And so we want to make sure that we're addressing food insecurity in that aging community. And so with many of these partners, we go deeper and we create some of those customized ways to work with them outside of the collaborative and creating some of those linkages within our system. And so one of the ways that we support one of our East Side programs and also that aging population is that we work with seniors, and we host a weekly meal for seniors at the Elders Lodge, where we prepare a nourishing meal and focus on creating those social connections. And then this year, we're going to actually be doing that meal preparation that's going to be driven by one of our community partners that is also a collaborative partner, World Youth Connect. And they're going to bring youth who will prepare and serve the meal and then spend time and socialize with the seniors. And we love that because then we can use that to build those intergenerational connections. And so again, over time, this work has branched out and inspired so much collaboration and deepened partnership to the point that it has even it lent itself to become like a new brand within Fairview that supports all of our food programming. And I think with that, I'm going to pause and pass over to Sarah for a minute to talk a little bit about some of our policy work, and let me know when you need me to advance the slide, Sarah.
Sure. So I've been involved with the collaborative since during my grad school days. I'm an original OG back in 2016. I wrote the business plan for the East Side table, but I was reintroduced to the collaborative 2018, 2019, and a co-founder of our policy work group meeting, now sort of in hiatus, but it ran from 2019 to 2023, 24. And this group was formed to build power among and within the collaborative partners and community members to better engage with policies that affect the health and well-being of East Side residents. And as mentioned here, and Christina alluded earlier, that like we're sort of, we're figuring out what our priorities are right now moving forward. But within that first 5 years, it was really spent on like building understanding, a lot of training, components. And I'll go over some on the next slide. But yeah, COVID was during, majority of our time together as a work group. And so it was really just spent meeting monthly, being in community with each other around, specific policy issues and learning. Next slide, Christina. So I'm a senior policy analyst with the Network for Public Health Law. And, through my organization, we've been a partner since 2019. And in our role as partner, we provide technical assistance and capacity building through training, facilitation, resource development, and referrals. Some of these include, we're co-leading our policy work group. We co-authored a 3-part law and policy series with community partners. Christina's going to put that link into the chat. We'll also include this, in our follow-up email. We also co-convened and led a Rooted in Faith and Community messaging for leaders to advance health equity training, where we had, some partners on the call, as well as some of my colleagues who provided a training on the moral foundation theory and how we can use this tool to speak across the aisle and, amongst in between communities, using moral foundations and different, whether you're more, what was the terms? Now I can't remember, but like we did this assessment. I'll put the link to the presentation in the chat. It was really great. And then some of my colleagues also presented on issues, that related to policy, law and policy on cultural safety, cannabis legislation, harm reduction, public health 101, mental health and suicide prevention, affirmative action, among others. And we also had we invited partners and had them also present at our national conferences and summits. Why like a public health law organization, on this, as part of this committee? Well, we also just wanted to increase our organizational, staff engagement and policy work at the local level. Myself and a few others, we also just expressed the desire to learn from community members and groups who work directly with underserved communities of color, who are most often, the most vulnerable to policy changes that affect the social determinants of health. What we sort of learned through this process is that, partnerships take dedication. Show up, you participate, you contribute in the ways that you can, but it's really just showing up, being yourself, being present. Authentic community engagement takes time, consistency, like I said, being present, openness, shared responsibility, and lots of relationship building, and listening. It does require dedicated staff, like we've been lucky that it's been the same people showing up, year after year, and like relationship building is key. And it has really filled up our own staff, capacity and learning. One member of my team, April Shaw, who presented on this committee a few months ago, she's gotten so much out of this work group. It's affirmed her learning. We're going to explore as a team, more cultural healing and safety. I'll put a blog post into the chat. So it's really a mutual benefit type of activity. Really got a lot out of it. And yeah, I'm just really excited to see where this partnership continues. And look forward to, if anyone has questions, happy to share. But we're gonna have a resource dump in the chat. So Christina, back to you.
Thanks
And
so much, Sarah. And
yeah.
I was not able to put the links that I had offered to put in the chat for you. My
Oh,
tech,
well, we can do it again.
tech's kind of like a toddler, likes to act up when you're in public, and I'm having one of those nights. So if you could have my back and plop those in there for
Sure
me, Sarah, that would
can.
be awesome. Thank you
Mhm.
so much. All right, and we're nearly done. Then we're going to have some time for questions and comments. But I had mentioned earlier that the work of the collaborative, we've been able to go so deep with it, and it really has informed so many other areas of Fairview. The collaborative continues to be this group of trusted partners who tell us what is on their minds. Sometimes they, help us if they feel like we're on the wrong course, but give us just really brutally honest feedback, and we really, really value that. And I think that has been key to our sustained partnership. And so because of these deep relationships and the structure that was put in place by Eastside Table, we were able to launch our Food is Medicine brand this last fall. And so we launched Fair Table. And, simple goal to advance food security, to reduce health disparities and diet related conditions. We also work to enrich our communities. And so with the goal of cultivating trust and engaging partnerships to share resources, assets, and capacity. And we really want to transform our systems with the goal of nurturing just and equitable food systems to ensure health equity. And so this has grown into a whole area of impact. We've got 3 different social determinant of health initiatives, and Food is Medicine is one of them. And so just a couple of impacts from 2024. I mentioned that piece about the 100,000 pounds of food processed every week, maintaining contracts with 41 BIPOC farmers, over 168,000 meals delivered to food insecure patients. And then that food programming. So food programming is available in all of our primary care clinics and hospitals. And so again, those SDoH screenings, and then linking patients directly to those resources. Couple of things, just some sneak previews about what's in store for Fair Table. Programs this year, we have a seasonal fresh food prescription program where we're able to prescribe someone a CSA share, and so they can get fresh fruits and vegetables during that growing season. We have a food voucher program, medically tailored and prepared meals. And so if it's determined that someone could have, again, a health condition that could be fixed by a very specific meal, we do have a medically tailored meals program. And we are working to see how we can make that reimbursable. There's some legislation up now, and so we're working on that medically tailored meal legislation. Food resource packets and shelf-stable food bags, and then just a number of other things with Eastside Table. We continue to deepen that work with Eastside Table and grow in the number of households that we can support every year. We also have the food distribution hub at the Fairview Community Health and Wellness Hub that is done in partnership with the Sane Foundation. We do a veggies for all fresh food distribution at our Health Commons Cedar Riverside site. And for those of you that are not aware of our Health Commons sites, we have 3 place-based community health centers. And so these are drop-in centers where people can come and get help translating, medical bills that they get. Or, we've had folks show up with, a bottle of or a bag of medications, and they're written in a language that is not their home language. And so help them interpret, how and when to take these medications. We do some diabetic foot care and some wound care, and do some healing touch. So we do some massage at these sites too. And so really do that to build trust in community and foster some of those direct connections with traditional healthcare. We also have a Twin Cities mobile market stop at the Rice Street Clinic every week. We have a free mobile food pantry at the Roselawn Clinic in partnership with Keystone Community Services. And then produce distributions at St. John's Hospital, and then 2 of our northern hospitals, our Lakes and Northland one. And then youth-led farmers market at the Eastside Clinic. And this year, we're also excited to be bringing online the Eastside Farmers Market, which I think is kicking off, I want to say June 8th. I might be making that up, but in early June. And that's a partnership with a number of Eastside partners and Urban Roots and Indigenous Roots Cultural Arts Center. And so I had earlier alluded a little bit to our role as an anchor institution. And so the work that I've shared today is made possible not only through deep, trusted community connections, but also through Fairview's commitment to being a true anchor in the communities that we serve. So being an anchor to us means, building trust, listening deeply, and responding to community needs, while also recognizing our broader responsibility to contribute to the overall well-being of our communities in every area where we have influence or resources to offer. And so we have a number of areas that we focus on as part of our role, and we're members of the Healthcare Anchor Network. We focus on inclusive local hiring, inclusive sustainable local purchasing. And so again, when we're hosting meetings or hosting events, we want to make sure that we're working with locally owned, whenever possible, BIPOC businesses. And so really wanting to support that local ecosystem, investing in community health. And so we were actually really excited to be able to have a designated percentage of Fairview's investable assets for investment within our portfolio of community health. So supporting the initiatives that I help support in the system. And then serving and leading locally. So really partnering with the community to, address and work toward mutual goals. I'll say one of the things that we've been really explicit in has been our commitment around the workforce component of this work. Right now, we know that our hospitals and clinics do not reflect the communities that we are working in. And so that is one of these areas of focus that has some pretty rigid metrics around what success looks like. And we're really looking to shift just what the fabric of our team looks like to be more inclusive and more reflective of the communities that we operate in. So now that we have, the strong model with the collaborative that Sarah and I shared about, which has branched out and really informed how we support one another and how we convene collaboratives, and some robust program responses that have grown out of that. The question is, where do we go from here? Do we build something new? Do we focus on sustaining what we've created? Say yes and yes. We definitely want to focus on sustainability. And so one of the ways that Fairview is investing in the future of this work is through the creation of the mHealth Fairview Center for Community Health Equity. And you can see our work kind of displayed on the screen. It's a powerful cross-enterprise partnership with Fairview Health Services and the University of Minnesota. And so the center is now the primary home for our whole system's efforts to address the social determinants of health. And it's where we house, as I mentioned earlier, our triennial community health needs assessment, and where we turn those learnings into action, both in the community and inside our clinics and hospitals. And so on the right side of your screen, you'll see our different focus areas. So food is medicine, where that East Side table work and fair table work lives. Housing is health. So we're working to really understand the connection between housing and having a safe and secure shelter and how that impacts our health. And then connection is cure. We focus on growing deep connections in the community, helping people feel like they belong, building trust, embracing other cultural practices that are outside of kind of the traditional medical mainstream and uplifting those. And so one of the big roles of the center is to be that of a community incubator. So taking what we've learned through partnerships like the collaborative and shaping that next generation of community programs to better address the root cause of these different health inequities. We also leverage this engagement infrastructure that we built. We built this across the system, helping service lines in different areas of our organization show up more authentically, showing them how to build trust and engage with community in meaningful and sustained ways. And a great example of that work is some of the work with our birth justice work. And so we're working alongside community doulas and birthing practitioners to transform the birthing experience within Fairview. And so we're focused on ensuring that doulas and support workers are recognized as valued partners, not just seen as extras in the room. And so we've taken steps to bring these different worlds together. So the folks on Fairview side that work in the birthing spaces, and then our community partners that are doulas and midwives and are working in community. And they're starting to have those conversations and share information so that we can all be part of that, a valued part of that ecosystem together. And then lastly, this work isn't just about community impact. It's also about helping us evolve as a healthcare organization. And so we're taking what we've learned from the community and applying it internally to make Fairview a more inclusive, equitable place for both patients, staff, but also the communities that we serve. And so with that, I will just say thank you, and happy to share more about any of the things that I touched on today. Also would invite Sarah if there was anything else that you wanted to share, or any questions or comments from folks in the room.